We are live once again, yes, and of course, if you check the time on top of your screen, it will tell you saying at 8:30, and that simply means at that time of the day we will hit your screen with we health talk, health discussions and all of that, and of course, see we get we own certified in-house doctor, where they always come every Saturday morning to discuss everything with the trend as regards to health. All right, last week or a couple of weeks now, we've been dealing with, or we dwelt on malaria and malaria vaccine as regards to COVID-19. So we ended that discussion last week Saturday. Dr. Barth don't do justice around. So for those of now we miss Sam, you can always go on top of our YouTube channel to watch, so that you can learn and of course understand everything with the doctor being take us through as regards to malaria. All right, so we definitely will be starting something new this morning where they're very, very interested at. I remember I've been asked Dr. Barth about the old Delta variant, and I'm excited, yes, to talk to now where we will enter this morning. Be that my name is Timothy, on top of your #1 family entertainment channel. Join me as I welcome my always looking elegant doctor.
Slimmest of them all.
Dr. Barth.
Yes, sir.
White and black has never looked this good.
Thank you very much.
Good morning, sir.
Thank you for your kind words. My name is Dr. Barth Ufoegbunam, your regular presenter of Health Matta on WAP TV, Medical Director, Grace Valley Medical Center here in Lagos. And also, the Changemaker President of Rotary Club of Ikeja South.
We are going to have that, Doctor. We should, yeah.
Very soon we'll be talking about a little bit of Rotary and what we do in Rotary. Okay, that was on a lighter note. Okay, so this morning, just like she rightly pointed out, we'll be looking at the trending news we have on our globe at the moment. And of course, we do know, we don't need to be told anymore that we now have resurgence of COVID-19 pandemic across the world. No continent is left out, except maybe Antarctic. Okay? So as it stands now, sadly, COVID-19 pandemic has affected more than 200 million people across the globe. 202,403,163 individuals. Worldometer is my source. And sadly, too, it has cost about 4.2 million, over 4.2 million deaths across the globe.
Dr. Sir, did you say over 200 million
people have been affected? And it has cost more than 4.2 million deaths across the globe. The good thing is that about more than 181 million individuals have recovered. Okay? People that were affected, but they were able to pull through. And of course, that on its own is some encouraging news. We do know that in the last 10 weeks or thereabout, we have continued to see an upsurge or uptick in the number of cases of COVID across the globe. And of course, the worst affected at the moment remains USA. Over the last 24 hours, they recorded 130,706 new cases. And it has caused a total death of 641 persons. Nearly 650,000 people have died in the US as a result of that. And the new deaths recorded in the US in the last 24 hours was 750. Next to US is India, with over 31 million people affected in that part of the world. In the last 24 hours, they've recorded 38,700 cases. And it has also killed 427,401 persons in India. And the last 24 hours, the fatalities recorded was 616. Third on the list is Brazil, with over 20 million cases. And let's bring it nearer home. And of course, we'll look at our continent, the African sub-region. South Africa tops the chart Over 2.5 million persons have been affected in South Africa. And the new cases recorded in South Africa in the last 24 hours was 13,523. And total deaths, fatalities that have been recorded in South Africa stands today at 74,352. And new deaths in South Africa in the last 24 hours was 479. Of course, next to them is Morocco. Nigeria, that used to be number 6, we've been able to go down all the way to number 10. So at the moment, total cases we have recorded in Nigeria is 177,142. Okay? And the new cases we have seen or recorded in the last 24 hours was 565. And total number of people who have died in Nigeria at the moment have exceeded 2,000. 2,181 persons have lost their lives to COVID-19 pandemic, unfortunately. Okay? That's not an encouraging news by any stretch of imagination. Okay? Suffice also to point out that the number of people that have recovered in Nigeria at the moment stands at 165,409 persons have recovered from COVID-19. And so far, Nigeria has tested more than 2 million people, 2,542,261. That's the number that we have tested, yes, in Nigeria so far. And I want to gladly and happily announce to all our viewers in Nigeria and across the globe that at the moment we have 143 molecular labs where people can walk in and have their tests done for COVID-19. 54 of them are privately owned, while 89 are public. We do know the amount of money that is required to have those tests done. That is for people who wish to have the test done, not for people who, by way of being unfortunate to catch the disease, and of course, if they are getting treatment from recognized government centers, they can be tested free. Okay, but in a situation where you want to do it yourself, you have an idea that there are a number of places that you can walk in and have the test done. Now, the next question that will be agitating anybody's mind is, what is responsible for this uptick in the number of cases? What is responsible for this upsurge or resurgence?
Really, what is
Yes, the major reason for this resurgence, of course, there are multiple number of factors responsible, but major, top on the list, should be what the WHO has tagged the variants, COVID variants of concern. COVID variants of concern. And of course, we do know that they've been named. WHO has given a number of classification to identify this COVID variant of concern.
David. Yes. I said David. COVID variant
of concern. Okay, so we have the number one in terms of affectation that is ravaging the whole globe, of course, including Nigeria, the so-called Delta variant. We do also know that we saw some months ago, not few months ago, we saw a variant in the UK. One variant emanated from UK that was tagged Alpha variant. The one that emanated from South Africa is now called Beta variant. And of course, the one that resurfaced from Brazil is called Gamma variant. Delta variant was said to have emanated from India since December last year. And of course, it spread like a wildfire to a number of countries of the world, got to Great Britain, and of course, as we speak, is responsible for over 95 cases of the circulating cases that we have in the US at the moment. What stands this Delta variant out is the fact that it has the transmissibility rate is far more than what we have witnessed with any of the other variants that we have mentioned. Not even the original COVID-19 variant can be compared to it. And what is this variant all about? It is a normal thing, just like it's normal for humans to grow. It is normal for viruses to undergo mutations. What that means is that they change their forms from time to time. And when they do so, it affects a number of properties that they possess. Now, to drive it home, let me use a man that appeared with a red cap today. You can identify this man with his red cap. In the next minute,
it changes
the cap changes to black or to yellow. So over time, it becomes difficult for you to pin down the man with any particular cap. That is just what happens with viruses. So they undergo mutations, and of course, some of the variants may fizzle out along the line. They may not become a variant of concern, but some other ones may become a lot more virulent than the original one that was first discovered.
Are they predictable?
They are not predictable. They are not predictable. That is why it has posed this enormous challenge. As we are speaking at the moment, the so-called Delta variant now has Delta variant plus. Now has Delta variant plus. Now that plus has just a change in one of his genomic sequences. One of the molecule is different, and of course that molecule is so important because that is what he uses to attach itself to human cells. This protein spike that uses to attach itself to the human cells. That is still being studied. What will be the outlook like? Delta variant is here with us in Nigeria. Mr. Boss Mustafa, ASGF, who of course is also the chairman of Presidential Steering Committee on COVID, PSC. He was talking last week, Monday, and he mentioned the fact that Delta variant has come into Nigeria. It is no longer news that Delta variant is in Nigeria. He also pointed out that Nigeria has about 6% increment in positivity rate. And we have been recording over 500 cases in the last couple of days. So it's like we're going back to Egypt.
Which is not nice.
Which is not good enough. The worst affected states in Nigeria at the moment, I think there are about 6 of them, according to him.
Lagos.
Lagos is said to have about 50% of the cases of Delta variants in Nigeria as of today. Akwa Ibom, Oyo, Rivers, Kano, Plateau, and of course FCT are the other states of the Federation where Delta variants are in existence. You just need to know about this. It's not just because we are having increment in numbers. We're also having increment in deaths, in the number of people that are being killed by this COVID-19 pandemic. And how can we protect ourselves? How can we protect our loved ones? How can we protect our community? The way to protect ourselves as it stands now is to adhere strictly to those COVID-19 prevention protocols that we already know of. Wearing of face masks, usually when you're in public places, when you're in crowded places, washing our hands, and a good number of them. But the most important of them all is to go get the COVID-19 jabs. Go and get vaccinated. Before now, Nigeria used to have just one of the vaccine candidates in existence. Talking about the AstraZeneca Oxford vaccine candidate, that has been the one that we have had in the last couple of months. But the good thing is that US has donated over 4 million vaccines, Moderna type. So those of us out there who may want to be choosy, you have an opportunity. You don't have. But let me also point out that so far, only 2% of Nigerians have been vaccinated. Now, I need to also point out this, because I was in a meeting recently, and where everybody was expected to wear face mask. One lady refused to wear hers. When we tried to question her, she said she has received the 2 full courses of COVID-19 vaccines. And I was quick to point out to her that regardless of the fact that you have been fully vaccinated, you can actually transmit the virus. You can get infected, okay, and you can actually pass across the virus to some others who may not have been vaccinated.
So what's not the essence of taking the vaccine? If
we'll know more about that.
Okay, so
when we come back from the short break.
I think it's just safe for us to go for our first break. Like waiting Dr. Barth talk. When we come back, I go re-ask my question. Because really, what's the essence of taking the vaccine? So guys, go nowhere. We'll be right back. No be news again. Say they don't report say this Delta variant really spread like wildfire don't enter Nigeria. Okay, but waiting we guys do, waiting we those things that we need to know. Are we going to be extra careful? I don't know. Those are questions I could ask Dr. Barth before anytime soon. All right, so before we go on that break, we talk say, yes, sadly, we don't get over 200 million persons really affected with this virus globally. And of course, we don't get over 4.2 million deaths globally. Or like that, not say nobody they spared, no country as a matter of fact as we speak. Okay, you mentioned one anyways, but this now global thing where everybody they try fight. So ladies and gentlemen, I don't want for us to open the phone lines this morning. You get questions that you want to ask the doctor, as regards to waiting when they talk about this morning, talking about the COVID-19 pandemic updates, talking about the Delta variant, and every other thing where you need to know. Feel free to call those numbers really on your screen. Turn down the volume of your TV set so that we'll hear you very well. So before the doctor been go on that break, if they talk about the fact that it was at a meeting and everybody been choose to wear face mask, and a particular person felt, okay, I've had my 2 shots, why do I have to wear mask? And he was like, no, you have to. And now they ask the doctor that because I feel the essence or the reasons why most people they try to take this vaccine are because, okay, I know once I take it, I should be immune, from being infected with the virus. So doctor, if I'm going to still have to get down with the virus, why do I have to take the vaccine, really?
Okay, thank you very much for that very important question. I'm sure that will be the question that will be on most people's minds as well. Now, let me give an analogy, okay? But before I do that, I want to say that vaccines are remarkably protective. Vaccines against COVID-19 are remarkably protective without any iota of doubt. Okay, now, what do I mean by that? Yes, they may have recorded what WHO referred to as breakthrough infections in a situation where somebody who has been fully vaccinated or fully immunized ends up picking up the infection. They are called breakthrough infections. Globally, we have them. The rate is still very negligible. Okay. Less than 1% of the affected people, okay, have actually had the breakthrough infection. I also would like to point out that even those that have the breakthrough infections, some of them truly have been hospitalized, but they never had, a good number of them had just mild illnesses. Okay. They didn't have severe illnesses. Also, a few number of them died eventually.
Mrs. Dolakpo from Ogun, good morning, madam.
Good morning.
How are you doing today?
I'm very fine, thank you.
All right, thank you. So please feel free to ask your question.
Please, I only want to ask that is the vaccine now available?
Okay.
Good morning.
Yes, the vaccine is available in Nigeria at the moment. I think any moment from now, we should be receiving the recently donated one from US. That is if we haven't received them, okay, because it's US has donated over 4 million vaccines. The Moderna vaccine candidate has been donated to us. So very soon it will be made available. There's also AstraZeneca batch that is being expected in the month of August. I'm sure any moment from now that will come into the country as well. Thank you very much. But as it stands now, only 2% of Nigerians have been so far vaccinated. Okay, I do know that there's vaccine hesitancy and all what not. Okay, but at least people have choices to make now, which to go for. I hope so too. I'm not speaking for the government. I'm not actually speaking for the government. Now, so back to the question you asked. So what's the need of taking the vaccine? The need for taking the vaccine is that it protects you, okay? It protects you in the sense that the chances of you having a breakthrough infection, getting infected while fully vaccinated is slim. That's number one. Okay. Number two, that should that happen, should that be the case, you're not likely to have a severe disease.
Okay.
You're not likely to suffer hospitalization. Even if you do, you're not likely to have to get to a level where you'll be needing supplemental oxygen, where you need to be put on oxygen or ventilator. Okay? Like typically you have in a scenario where an unvaccinated person gets infected. Okay, so the picture is like this. Just imagine have a caller.
Fred from Lagos. Hello, Fred. Fred.
Good morning.
Good morning. How you doing?
Good morning.
Good
Yeah,
morning.
good morning, Fred.
Okay, so I just want to, give some kind of advice to government.
Okay.
If they really want to eliminate this virus, let them start giving people, the vaccine door-to-door, immunization. Instead of saying they are budgeting so much money, this, that. Many people have not even collected that single default vaccine. Go outside, go to many places. You will say, go to Lagos. Many people, they have not. So why can't they go to, I think they are giving polio, the way they used to give polio. Let them be into the house to house and see people. You will see many people will come and collect this thing. I don't know why government used to find it very hard. They be expecting donation from US. They won't even, something that if they really want to eliminate this thing in Nigeria, let them do it the way they used to give polio to children in the house. Also, house to house vaccine. That's how China is doing now. China wanted to immunize all their citizens. How is it that possible?
Okay.
Nigeria cannot do such thing.
All right, we got you, Fred. We got you. Thank you very much for that.
Thank
Doctor
you
will
very
respond
much.
in a bit.
Thank you very much. I wish what he said could be possible in Nigeria.
Is it possible, really?
That will make a lot of difference. But unfortunately, in as much as I'm not speaking for the government, I can tell you that the challenge we have is not having enough. It's that simple. The vaccines that are coming in are not going to get across to, not everybody will benefit.
We are over 2 million,
yes,
200 million
yes,
citizens.
so that's the challenge. Scarcity is the word. And that is why WHO has been singing equitable distribution, equitable distribution, equitable distribution. Rich countries of the world, they should think about the poorer countries. Okay, and of course, regardless of the fact that US is having a battle of a momentous battle on his hand, he was still able to donate a chunk to Nigeria. Okay, so the ones they donated cannot go around. That is the truth of the matter. And of course, government will have to prioritize.
Yeah.
They started with health workers.
Okay, so Bamidele, good morning.
Yeah, good morning, madam.
Good morning, sir. How are you doing today?
Very fine, I guess.
Very well. All right, please go on.
Yeah, I'm with you people this morning, and I've been listening to a lot of, questions and observations. But my even issue is that I've been going all around the health centers, and yet I've not gotten the vaccine. My issue is how can we be updated or notified if the thing is well circulated so that we can get it?
Sorry, I didn't get it.
Okay, so you say you've been trying to get the vaccine, Abi?
Yes, all around. I've been going and,
Okay, so for those places where you don't go, what did they tell you?
They have been saying they have not given an approval to,
Okay, so are they saying the vaccines are not available or you are not eligible to collect? Okay, they are saying it's not available.
It's not available. Yeah, so we don't even know if we can be notified so that we won't be moving around.
Okay, so talking about location.
Yes, thank you very much. Hopefully by our next presentation, I'll be able to give you updates on some of the centers where you can actually go, and then be able to give you updates on the availability. But keep in mind, like I said before your question came in, that government will have to prioritize because the numbers that are coming in can actually not go.
Okay.
Yes, can't go round. That is his unfortunate truth. No, can't go round. So they need to prioritize. Then again, some of the vaccines are the ones that you need to take 2 shots. Okay, so sometimes what they do is that when they give, if you have 4 million, you know that that 4 million cannot be given to 4 million individuals because those individuals will have to get their second shots. Okay, so once they dispense the 2 million, they will reserve that for second shots for those other set of people.
Okay, sir, but I think the second shot doesn't come like almost immediately because I've got a couple of persons they don't get them and they'll be like, okay, they told them to come back in a couple of months. And I'm trying to understand why they take that long for me to come back for my second shot. Like a lot will go down in between those time while they wait.
You know, when these vaccines came out, the makers actually gave some stipulated timing in terms of what, if you take the first dose, you're expected to take the second within a space of 21 days and all that. But the scarcity of vaccine made them to also go back and said, okay, it could stay for this so number and so number of months is still valid. And if you get your second shot within that time, you still have your full coverage. Okay. Now, also, I want to point out, before I go back to your question, because I actually want to give an analogy on that, because you asked a very important question. What's the need going for the vaccine? If people who have had the vaccine, fully immunized, can pick up the infection. Okay, so the vaccine, even when you have had the 2 shots, you expected, the effectiveness does not kick in until after about 2 weeks. Okay, so we need to point that out. Okay, now going back to your question, why should somebody go for the vaccine? Since even with the fully vaccination, you can still get infected with COVID-19. Now, let me paint a picture like this. Imagine having a sandbank, and then you have a lot of rocks that are kept there, deposited there to protect a city from a storm, from an ocean. Okay, now that sandbank, those protective measures will be very effective. But if a hurricane kind of wave comes, it will be able to push through. Okay, so the people who are fully vaccinated are just something like that. Okay, so they will have some degree of protection. But when the hurricane type of COVID-19 variant comes calling, it may breach the integrity of it, and of course, that will lead to a breakthrough infection. That can happen. And that is not to say that it has made going for the vaccine unimportant or useless. No, because the unvaccinated people, the large percentage of the people who are hospitalized who end up having severe disease are usually the unvaccinated members of any community. And unfortunately, just like some of us have experienced in this part of the world, a lot of us want to willingly go, but we can't access it. Victor from Kaduna. Good morning, sir.
Good morning. How are you doing?
I'm fine, thank you.
I just want to ask, what is the government doing concerning the production of this vaccine for our Nigerian people?
Did you get him?
Yes, I got him. Making of vaccine, it's not an easy task. Making of vaccine is not an easy task. I do know that Nigeria is also making effort to see if we can produce one locally. Okay, so but the ones that we have now in existence, we have a good number of vaccine candidates that are still at various stages of development. But the ones that have gotten approval that can be used for humanity, that can be used for the population, are the ones we are restricting ourselves to. If I tell you that there's one that was recently produced in Oshodi, will you come and take? You wait for the authorities, of course, certify that it's safe, that it cannot kill and all
certified,
whatnot. So is getting a vaccine, especially for COVID, involves a lot of rigorous processes. So plenty of them. Okay, so it's not easy getting one. That I can tell you. The safety is a big challenge. Safety issues are a big challenge. You remember one of the reasons why people were shying away from presenting themselves for vaccination was the reason because a good number, not a good number of people, a handful of people who got vaccinated started having all sorts of reactions, life-threatening reactions though. It's not abnormal for someone to get vaccinated and then have some mild symptoms, headache, fever, usually will clear within days. But when you have things like blood clot, life-threatening reactions, Okay, so that's part of the reason why people started shying away from going to get vaccinated.
Okay, Doctor, hey, another call is coming through, but maybe after the call I'll ask. Victor, we had Victor before. We have another Victor. Victor, good morning from Yola.
Good morning.
How are you doing?
I'm fine.
All right, please go on. Go on with your question.
Sorry, I just want to chip in this. The problem we are facing in this regarding this COVID-19 vaccination, I think it's all about these community sensitizations and education. Yeah, because majority of the people, they are still scared to even collect this vaccine.
No lie.
And what I really understand is I think if government really wants to eradicate this COVID-19, they should try to chip in these religions, mobilization. Because as of now, some pastors and some imams, they are still preaching against this vaccination. Even last week, I was in a church when the pastor was even encouraging the members not to receive vaccine. That is about all these CCCs and co. So the problem, and in Nigeria, many people, they observe and they do whatever their pastors and imams ask them to do. So in as much a pastor is preaching that they should not collect the vaccine, no matter what people say, they will not collect it because they obey their pastors. So I think the government needs to encourage and bring in these religious leaders on board so that they can encourage their people to collect. Because if not, I'm telling you, this thing is playing along, especially in the north.
Thank you very much, Doctor.
Really?
On the head.
That is nothing more to add to what he has said. Okay, so this set of leaders need to be brought on board. They need to be carried along. They need to be educated that it is not what they think it is. Because I can tell you there are a lot of controversies out there, a lot of
seriously agree.
I've seen and read some of them that people who had one particular vaccine will not last beyond 2 years. And not. These are things that can ordinarily discourage people coming forward to have this jab. And I can tell you that this jab is the hope of humanity. This vaccine that we are talking about is the only hope of humanity. Because those face masks, wearing them is not easy. In fact, take a look at the people that you come across on the streets of Lagos. How many people still wear the face mask?
So actually when it started, I saw everyone wearing, but right now, I don't know.
But with the resurgence now, by the time we start raising the awareness again, people will know that this thing is back again. This thing is back on. People don't even have an idea that Nigeria has started recording over 500 cases per day.
Yes,
people don't even have an idea that people are dying in Lagos as we speak as a result of COVID. Okay, I was looking at the active cases we have in Nigeria. We have about 9,000 active cases in Nigeria as of this moment. Over 9,000 active cases.
Okay. All right, so guys, still on COVID-19 pandemic update. Doctor, before you actually finished answering my question, the caller mentioned elimination. And in my head, doctor, I know one day, I don't want to sound otherwise, but then let's just be optimistic. We are trying to be optimistic, but at the same time, let's be realistic. So now let me ask, doctor, do you think that COVID-19 has come to stay, just the same way we are trying to manage HIV and AIDS? Like, can it be eliminated, or we should just accept our fate that it has come to stay?
I'll give you an honest answer, what I think about it as an individual. I think, unfortunately, we are not likely to escape it in the foreseeable future. It has actually come to stay. Because if with the latest efforts we have made, the scientific community has made with vaccination, if the vaccine cannot stop, a vaccinated individual can actually transmit the infection to an unvaccinated person. Meaning that people who are vaccinated can still carry the virus in their throat within themselves and pass it across to unvaccinated people. Coupled with the fact that the breakthrough infections have been recorded in a number of places, the only thing that could be the game changer is to have a larger percentage of our population immunized. At the moment, there are only few countries of the world that can boast of having achieved that. US, Israel are a good examples of people who have been able to achieve that. At the moment, over 70% of Americans have received at least one dose.
Over
over
70%.
70%. More than 50% of Americans have received at least the full doses, the
That means
2
they're
full
doing
doses, have been fully vaccinated. Regardless of all that, look at the numbers,
number of deaths. That's what I'm saying. Like,
the number of new cases that are churning out on daily basis. That on its own is frightening. Okay, so that is why, because of those recorded breakthrough cases, they have to change the mask mandate. The guideline has to be changed again in July by Centers for Disease Control in the US, CDC. They have to change it again to say that both vaccinated and unvaccinated people should still wear their face mask. So if you're out there, you're a Nigerian, you've not been able to get vaccinated, please, this is one vaccine you must not lose hold of.
Don't joke with.
Keep it on your face, especially when you're out of your home. When you're entering supermarkets, buses, train, aircrafts, subways,
No,
we don't have it.
place without your mask.
Keep it on your face. Okay, so at the beginning of the pandemic, we had challenges getting those face masks, but not anymore. Now that the face masks are everywhere, people are even having difficulties. Sometimes people will come into hospital settings where we still insist that everybody must have the face mask on. When you ask them to get their face mask,
they find it very
they find it difficult. Sometimes some of them will attack you and then make some foul languages and all of that. But we don't need to be discouraged. Okay, we don't need to be discouraged because I think part of the things we need to do now to sensitize the public is to begin to drum up, begin to show. Yes, there are limitations to what we can show, but people who are having these challenges, at least let's be bringing it to our consciousness that it's killing so and so number of people. So number of people have been affected on daily basis.
But at the point, they were actually doing that in Lagos, Doctor.
Yes,
I know some of the channels that were like,
we're doing that, but the publicity has kind of gone down.
And why? Yes, because I was almost asking, you know, when you were talking about the number of hospitals, testing labs, Doctor, you were happy.
Our major avenue for publicity in this country has some challenges at the moment. I wouldn't want to get into that. Otherwise, you probably would have been seeing the regular NCDC updates. Yes, coming out on daily basis. Okay, so that's a part of the reason why communication appears to be stalling. It is not what it should be. The sensitization is going down by the day, and of course, the virus is not looking at us.
This is like the best time for us to get sensitized.
Yes, we need to get sensitized. We need to bring it to the knowledge of the public, to the common man on the street, that this thing has come back again. No, people are now getting it in hundreds. Okay, because at a point Nigeria was recording 25 in a day, 30 in a day.
500.
Yes, but we are back on from where we started. Samuel from Lagos. Good morning. Good morning, sir.
Good morning, sir.
Yeah, thank you very much. Go ahead.
Please, talking about sensitization. How do you please, explain more on this DNA in our bodies, because that is actually one of the things that people out there are using to indoctrinate people's mind, telling them that this affects the DNA, changes their DNA to suit to the antichrist, anti this, anti that. So because this is what most of the religious leaders are using. So how do you explain to them, how do you explain to the populace the function of this vaccine on our DNA, so that they will not become more confused about it, because they have been told that once their DNA is altered, they are now different people altogether. They are not human beings again. They are now monsters, and they keep showing them places where somebody will take a bulb and place it on where he was vaccinated. And
okay, don't
Thank
worry.
you very much. Thank you very much. He has made a very good point there. I watched that video. I don't know how I came across it. Somebody claimed he took the vaccine on this hand. And then he brought a coin and placed on that hand, and he cut. He placed on the other hand that he didn't have, and he fell off. At the end of the day, the guy was able to demonstrate that he actually hid an invisible gum there. People do all sorts to discourage people. I don't know what will be their benefits. Okay, so just keep in mind that there are a number of charlatans out there. Beyond that, there are some people too who truly believe some of those things. But I can tell you that all of that are beginning to die down now, because health workers, it got to a point, those of us who have gotten vaccinated will come to social media and show the picture of we getting vaccinated, and people will say that after the vaccination, I'm still the person I used to be. I also would like to point out that all the COVID vaccine are not of the same type. Okay? There are few messenger RNA vaccines, which of course is the Moderna and the Pfizer BioNTech. Okay, AstraZeneca is not a DNA. It doesn't have DNA vaccine makeup. Okay, so all of the vaccines that we have in circulation are not all the same. So they differ from each other. Okay. Only very few are similar. Just like other vaccines that we have been having before now. The vaccine for hepatitis B, the vaccine for cervical cancer, the vaccine for measles that children usually take at 9 months of age. So there are so many vaccines out there, okay? So they don't change anything. They do not change anything. Very soon it will be 2 years. So those of them that say that all the people that got vaccinated are going to die within the... there is no such thing. There's nobody that is out there to waste any particular population. As a matter of fact, the makers of the vaccines are the ones that are even taking it most. Okay, so this part of the world, we are waiting for them to give us some handout and then see what our governments will be able to purchase at the end of the day so that it can go round. Okay, so if US has gotten over 50% of their population vaccinated, I'm wondering when will Nigeria or probably an African country be able to achieve that? It may take us many years, if not decades, to get at least 50% of our population vaccinated. Okay, so that is the truth. So if you're listening to this program today, the vaccine does not kill anybody. If it does, the number of people it kills are so negligible. And I can tell you that the blood clots that were recorded in commensurate to the number of people that were vaccinated cannot be compared. The number of people who may be unfortunate to have those serious, severe, life-threatening reactions are so negligible. They are so insignificant. However, to a family that lost someone as a result of that, you can't say that to them. Okay, so but we just have to, okay? Because if you get vaccinated, you're helping your community. Keep in mind that you may be coming across somebody who may be immunocompromised, somebody who for one reason or the other may not be able to go get the vaccine. People who have HIV and some other challenges, or people who have done organ transplant. Okay, so, but my worry truly is people who are, none of the vaccines so far covers the age range of 5 to 12 years. That's my worry. Okay, so, and these variants of concern are also being seen in younger age group. Pregnant women today can get vaccinated. But at the beginning of the discovery of vaccines for COVID-19 pandemic, said pregnant women shouldn't take at that time because they were not part of the people that participated in the trial. But all of that are changing now. Pregnant women can take the vaccine and stay protected with their unborn baby
Doctor,
as well.
I was talking about the Delta variant. It's not like they have to make another kind of vaccine for it, right? The vaccines we have right now can actually work for
the
that.
vaccines we have, they all have this different efficacy rates, okay? But the vaccines we have shown good activity in protecting against these variants of concern. Okay. Also, the makers of the vaccine are also working on the possibility of bringing out a booster dose. So we may have a situation where people will have to get a third vaccine along the line. Okay, so all cards are on the table really, because if you look at the numbers that are being numbers of people that are getting infected on daily basis, I can tell you they are frightening. They are frightening, truly frightening. If you look at the number of people that is killing, As a matter of fact, I think about a month ago or thereabout, that Matshidiso, the WHO rep for Africa also, actually said that Africa witnessed its worst COVID-19 infection rate in one particular week. We saw our worst week. Okay, so Africa is not left out. Okay, but the only thing that we are seeing today is that it's not killing people as much as it was doing before. Largely because of the partial immunity that people who have been infected may develop, people who have had the vaccine also will develop, and all that. But if we have the vaccination rate increased in any particular community, that will be a game changer, and that will make a lot of meaning. Okay, so if you're out there, you haven't gotten vaccinated, please, if you have the opportunity of getting vaccinated, utilize it. There is no such thing that vaccine kills anybody or that it changes anybody's DNA. There is no such thing. If you need to know more about this, you can give me a private call at the end of the show.
Yep. And of course, we'll not stop to sensitize people.
Yes.
Just like that Bruce call us, they obviously they informed. So for those that are informed, please let's help inform others and just let them know the importance of having the vaccines. Thank you so much for joining us on the show.
So we'll see you again
next week, Saturday. Make sure you stay tuned to our TV.
Yes.
Bye, guys. Thank you so much, Doctor.
Yeah, thank you very much.